So my name is Deanna Morrison. I'll be completing the assessment today. So I want to demonstrate range of motion on myself first before we actually meet with the patient. So we'll start with fingers. So this would be flexion, extension, abduction, adduction. For the wrist, you would have flexion, extension, radial deviation, ulnar deviation. The elbow, you would have flexion, extension, supination, pronation. Then you would move to the rotator cuff. For the rotator cuff, you would have flexion and extension, circumduction, abduction, adduction, internal rotation, external rotation. For the neck, you would have the flexion, extension, left rotation, left lateral bend, right lateral bend. For the spine, you would have flexion and extension. You would have left rotation, right rotation, left lateral bend, right lateral bend. And then you would move to the hip. So you would have flexion and extension, and then you would have abduction, adduction. You'd have internal rotation, external rotation, and then you would move to the knee. So the knee would be flexion and extension, and then the ankle, you would have plantar flexion, dorsiflexion, inversion and eversion, and then the toes you would have flexion and extension. So the first thing I want to do is have two patient identifiers. So if you'll please give me your name and date of birth.
Shelby Allen, 32594.
And I will be completing the assessment. My name is Deanna Morrison. I would do proper hand hygiene, and do you consent to this assessment?
Yes.
Okay, so the first thing we want to do is check the stability of her knee joint. As we're doing each one of these tests today, we would want to check bilaterally and compare the sides, and you would be wanting to assess the unaffected side first and then compare it to the affected side. And if any time during this exam you feel any pain, please let me know. Okay, so the first exam we're going to do is going to be the valgus exam. The valgus exam it checks the MCL. So if you will, just bend your knee up. So we're going to be pushing medially on the knee. We're going to feel the medial joint line, and we're going to be pulling anteriorly on the ankle. Do you have any pain? Okay, and there was no gap felt at the medial joint line. So now we're going to do the Vargas test, and that's going to check the LCL. So we're going to push laterally on the knee. I'm going to feel the lateral joint and push medially on the ankle. Do you have any tenderness or pain? No. So she did not. There was no gap felt, so that would be a negative Vargas exam. The next exam we're going to do is the anterior drawer test. It checks the ACL, and we'll do the posterior drawer test, which checks the PCL. So for the anterior drawer test, we're going to stabilize the foot, and then we're going to pull anteriorly on the tibia, and there was no shift out from under the femur, so that would be a negative anterior drawer test. The PCL we're going to check with the posterior drawer test, so we'll apply pressure posteriorly. There was no posterior shift, so that would be a negative posterior drawer exam. So now we're going to move to the McMurray exam. That checks the meniscus. We're going to assess both the lateral and the medial meniscus at this time. So if you will, bend your leg up. So I'm going to cut my hand over the knee, and for the medial meniscus, we're going to apply pressure laterally. We're going to rotate the foot out, and we're going to straighten the leg. And we're listening and feeling for any pops and clicks. I did not hear any. So for the lateral meniscus, we're going to rotate the foot in, and we're going to pull laterally, and we're going to straighten the leg out. And there were no pops or clicks, so that would be a normal exam, negative for any meniscus injuries. The next test we're going to do is for carpal tunnel syndrome. So if you will, please sit up on the edge of the bed. So have your hand. For the CTS exam, we're going to check the medial nerve impingement, and any tingling or numbness or pain felt during either the tensile test or the Phelan's test would be a positive sign for possible CTS. So as I tap the nerve, tell me if you feel any pain, numbness, or tingling. No. So we would check this bilaterally. That would be a negative tensile test. And then if you will, place the backs of your hands together and apply pressure. We would apply pressure for 60 seconds, and then we would assess for pain, numbness, or tingling. Do you have any of that? So no pain, numbness, or tingling in the second, third, or fourth fingers would be a negative Phelan's test. So the next test we want to do is the rotator cuff. So if you will, please stand. So first we want to assess the sits muscles. So the first sits muscle is the supraspinatus. Tell me if you have any pain. The infraspinatus, the teres minor, and the suprascapularis. Did you have any pain during that exam? No. Okay, so there was no pain felt. That was normal findings. There was no muscle spasms that I felt either. So the next test we want to do is going to be for range of motion. So if you will, if you'll face me, and we'll do flexion, and then we'll do extension, and then we'll do abduction, and then we'll do adduction, then we'll do circumduction, and then we'll do internal rotation and external rotation. So we want to check the strength of the sits muscles, so we're going to check the supraspinatus. We're going to do 2 tests for that. And the first test would be the drop can test. So if you'll stick your arms straight out towards me, turn your hands inward. I'm going to press down on your arms if you can't hold them in place. So the strength was normal and equal bilaterally, you can drop them. And so that would be a negative exam for any damage to the supraspinatus muscle. We're also going to do the drop arm test. So if you will, put your arm out at a 90-degree angle and then just slowly let the arm come down. And what we're looking for is any weakness or pain during this exam. And did you have any pain? There was no pain or weakness noted, so that would be a negative drop arm exam. The Appling scratch test tests the general overall mobility of the rotator cuff. So if you will, turn this way. And I want you to take your hand and put it over your back and touch your opposite side of your back. Okay, and if you'll come back down the other way, we want to note where this is. And we would check this bilaterally, of course, and compare. That's good. And she had good overall rotation without any problems with that. So the next test that we're going to do is, we'll move on now to the, we'll move for the infraspinatus test. So if you will, I'm just going to have you bend your arm here and then push your arm out towards me against resistance, and that's adequate strength, and we would check that bilaterally to make sure they're equal. And then for the subscapularis, we would have you put your hand behind your back, and then we would lift the hand slightly away from the back and keep me from pushing your arm up if you can. And we would want to try to decrease the angle there, and she was able to hold it there. So that was adequate strength. Of course, we would compare bilaterally. The next exam we're going to do is going to be the scoliosis exam. So if you'll turn with your back to me. So we want to look at the shoulders to make sure they're level. We want to look at the gluteal folds, and we want to look at the iliac crest to make sure they're level, and they are. We're going to check for any winging of the scapula. So if you will, put your hand up, pressing against my hand. There's no winging of the scapula. We would check this bilaterally. And now we're going to have you bend over. We would do this without a shirt on, but for test purposes, we're just going to look today. We would look for symmetry across the back. We would want to feel down the back to make sure that there's no deviation to the left or right, anterior or posterior deviations, and there's not, so that would be a negative scoliosis exam. The next exam we want to do is for the lower back. So we're going to check the paravertebral muscles, and you tell me if you have any pain. And while I'm doing this, I'm also feeling for muscle spasms. Do you have any pain? Okay. So now we're going to palpate over the vertebrae. If you ever have any pain over a bony prominence, that might be an indication of bone fracture. So let me know if you have any pain. Any pain? So that would be negative. So now we want to do 2 tests to see if there's any nerve impingement on the lower back. So if you'll have a seat on the bed and then lay down on your back. So this is a straight leg exam. So we'll have you lift your leg up and to pull your toes this way. Do you have any pain? No. So lift this leg up till you feel some pain and pain. No, flex. Okay, so we would have the patient differentiate between nerve and muscle pain if they were to indicate that there was a painful movement. We'd also want to note at what degree the pain was felt on both sides. So the next test we're going to do, if you will, we'll have you sit up. And so the next test we're going to move on to would be the we're going to do the range of motion for the back. If you will, please stand up. So we'll lean forward and then lean back, and then have you turn to your left side and turn to your right side, and then lean over to your left and lean over to your right, and that was adequate range of motion, and there was no problem there. So the next thing that we want to assess for is possible meningitis signs or meningeal signs. So if we'll have you lay down on the bed, please. Okay, so for this test, the first one is going to be the Brudzinski sign. So we're going to have her touch her chin to her chest. Okay, that's good. You can relax. And what we're looking for here is any movement in the hips or knees. There should not be any movement. So movement would have been a positive Brudzinski sign. The next is going to be the Babinski sign. So what we're going to do is we're going to check, run the handle of the hammer, and we're going to move it up to the lateral aspect of the foot across the ball medially. And normally you would either see no movement or you might see a little bit of the plantar flexion, but fanning of the toes and dorsal flexion of the foot would be an indication of a positive Robinsky sign. The kerning sign is the next one we're going to look for. So we'll have you just lift your leg up and tell me if you have any pain. Okay, and the other side. Okay, so no pain is felt. That's a normal finding. If she were to feel pain, that is not a definitive test for meningitis because it may have something to do with lower back problems with muscles or nerves. So that's not a definitive sign for meningitis. Okay, so the next test we're going to do is coordination. So if you will stand up, and I'll have you just walk out that way. And we're going to be assessing her gait, make sure it's fluid, opposite hand and foot movement, and if you'll come back, heel to toe. And we're going to be making sure that when she walked out the first time that the foot and the two heels were about 5 to 6 inches apart as she walked away from us. Okay, now if you will walk out on your tiptoes. And back on your heels. Okay, you just start about there. And can you hop? And one foot and the other foot. Okay, so during that whole exam, she was able to maintain balance. She had good rhythmic movement as she was walking, so that was all normal. So now, if you'll have a seat on the bed, we're going to do 3 exams, and these are rapid moving exams. So we'll have your hands here, and then you'll flip them over this way and do that. Okay, close your eyes and do it. All right, you can stop now. So now we're going to do finger to thumb test. So you would want to do both sides, and faster, and close your eyes. She was able to maintain coordination. That's good. You can stop now. So the next test we're going to do is she's going to tap the ball of her foot onto the floor, and then she's going to tap it onto my hand. Okay, that's good. So we would assess that bilaterally, and that was normal. So the next test we're going to do are point-to-point tests. So the first test, put your arms out beside you, and then alternate touching your nose with your finger. Okay, close your eyes. Okay, you can stop. The next test we're going to do is I want you to touch my finger, and as you move your finger away from me, I'm going to move my finger and then touch your nose and then come back to my hand. Okay, so that's very good. Okay, so the next test we're going to do is going to be if you'll lay on your back, and if you'll place your ankle up on the shin of your other leg and slide it down. And we're looking to make sure that she can maintain contact with skin-to-skin contact, and she does. So that's normal finding. So the next test that we want to do, if you'll stand back up again, sorry. This is the Romberg test. So if you will, straighten your arms out straight out in front of you. I'm going to have you close your eyes, and what we would want to look for here for 60 seconds is if she's able to maintain balance. And a slight sway would be normal, but if she were to have to step to maintain her balance, that would be abnormal. So you can open your eyes now. So if you will, turn your hands over. And so this is the pronator drift exam. So what we're going to look for, she's going to hold her hands out for 30 to 60 seconds, and we're going to look to see if there's any rotation of the hands inward. So there's no rotation. Then I'm going to push your arms down, and you bring them back up. And there was no rotation as she came back up. So that would be a negative pronator exam. So the next exam we're going to do is for the sensory. So if you'll have a seat. So we're going to do pain and light touch exam. So I'm going to touch you with an object, and I want you to tell me if it is painful or if it's soft, okay? So I'm going to show you, I'm going to give you an example of each one first. That would be pain, and that would be soft touch, okay?
Pain. Soft. Pain. Soft.
And as we're doing this exam, we want to
Soft.
make sure that we're only doing areas that she is has the bare skin.
Pain. Soft.
Okay, and we would check the feet.
Soft. Pain. Soft. Pain. Pain. Soft. Pain. Soft.
Okay. And so the next test we want to check is positional sense test. So we want to hold on to the lateral aspects of the fingers, and when I pull, I will move your finger. This would be up, and this would be down, okay? So close your eyes for me, and
Up. Down.
okay.
Up. Down.
And then we'll check the feet.
Down. Up. Down.
I'm sorry.
Down. Up.
Okay, so that was all normal. So the next thing we want to check is for diagnosis, And so I'm going to lay something in your hand, have you close your eyes for me, and then you tell me if you're able to identify it, okay? Okay, very good. So, and then if you'll keep your eyes closed for me, the next test we're going to do is racocenia, and so I'm going to write a number with my finger in your hand, and you tell me what number it is. 30. Okay. All right. So again, we would test each one of these bilaterally, and that's the end of it then.